Alright, so today I'm going to be talking about pancreatic cancer. And you can follow along with me in the slides that I included in the email. And when you pull up those slides, the first slide is signs and symptoms of pancreatic cancer. So the issue with pancreatic cancer is the signs and symptoms often go unnoticed in its early stages, which is why oftentimes pancreatic cancer is caught in its later stages when unfortunately it's become too late, meaning the cancer has spread to the other parts of the body. In this case, it goes straight to the liver, which becomes fatal. Some of these signs or symptoms are very common, meaning that if you have one of these signs or symptoms, it does not mean that you have pancreatic cancer. The first being experiencing pain in the abdomen area and or your back area. This pain is triggered by pancreatic cancer, that the cancer grows on the body or tail, causing the enlargement of the pancreas, which causes it to then press on organs nearby, which triggers this pain. It also can affect the nerves around the pancreas, which can also trigger this pain. Another sign is weight loss. Individuals that suffer from pancreatic cancer often lose weight unintentionally, as they oftentimes have little to no appetite. My father, who actually had pancreatic cancer, was overweight and thought he was losing a lot of weight due to walking more. And looking back now, I think that was actually one of his signs of his cancer. Another sign is yellowing of the skin and yellowing of the white areas in the eyes, also called jaundice. This is one of the most common signs of pancreatic cancer. The cause for this is a buildup of bilirubin, which is a dark yellow substance made in the liver. When pancreatic cancer spreads, it often goes to the liver, causing jaundice. Enlargement of the gallbladder or liver is another sign or symptom. When the cancer blocks the bile duct, it causes a buildup, making the gallbladder larger. It can enlarge the liver when the cancer has spread there. A blood clot in a large vein is another indication. This can cause swelling and pain in an affected leg. Sometimes the blood clot can then travel to the lungs, which causes chest pains. The cancer can also press on the stomach, which causes for nausea or vomiting, and in some rare cases, pancreatic cancer can cause diabetes. This is because it destroys the insulin-making cells. As well as feeling fatigue and depression is another sign or symptom. This takes us to slide 2, focusing on causes, risk factors, and prevention. So some risk factors of pancreatic cancer can be avoided, while others cannot. Family history is one of those ones that cannot be avoided. It's something that can put individuals at risk. Pancreatic cancer can run in some families. This puts these individuals at high risk because of this inherited syndrome. An inherited genetic syndrome is another risk factor that cannot be changed. Inherited gene changes can be passed down from a parent to a child. These changes are responsible for about 10% of pancreatic cancers. These gene changes can result in an increase of other cancers as well. Gene changes can also lead to chronic pancreatitis. This is often due to an inherited gene mutation. Individuals with this mutation have a high risk of developing pancreatic cancer. Risk factors that many individuals can avoid for pancreatic cancer, as well as other health conditions, include tobacco use. Smoking is one of the top direct links to pancreatic cancer. When an individual smokes, their chances of getting pancreatic cancer is twice as high as individuals who don't engage in tobacco use. 25% of individuals who are diagnosed with pancreatic cancer are believed to have gotten it because of using tobacco. It's also thought that the risk of pancreatic cancer starts to descend as an individual stops the use of tobacco. Being overweight is also another high risk factor. Obese individuals are 20% more likely to develop pancreatic cancer. Pancreatic cancer is also more common in individuals who have diabetes, in most cases type 2 diabetes. This also goes in hand with being obese, as many obese individuals do have type 2 diabetes. Unfortunately, my father, who had pancreatic cancer, he was a smoker for 20 years. He was overweight and he did have type 2 diabetes, which is why I believe these 3 risk factors are very important for an individual to avoid. Being in a workplace that exposes you to certain chemicals can also put you at risk for pancreatic cancer. An individual's diet can affect their exposure to pancreatic cancer, as some studies shows that eating red and processed meat and not enough fruit and vegetables can put an individual at more risk for the cancer. Finally, alcohol. Alcohol is linked to pancreatic cancer as well. Studies show that heavy alcohol use is linked to pancreatic cancer. It can also cause conditions such as chronic pancreatitis, which then increases your risk for pancreatic cancer. Now, when focusing on how to prevent yourself from pancreatic cancer, there's obviously no clear way to completely avoid it, unfortunately, but avoiding all risk factors that are preventable increase your chances of not getting this cancer. This includes staying at a healthy weight, avoiding tobacco usage, limiting alcohol usage, and limiting your exposure to chemicals. This takes us to slide 4, pathophysiology. So, in order to understand what pancreatic cancer does to your body, you have to understand your pancreas to begin with. Your pancreas is about 6 inches long and it releases hormones, including insulin to help your body process the sugar in the foods that you eat. It also produces digestive juices that help your body digest food and absorb nutrients. Pancreatic cancer occurs when cells in your pancreas develop changes in their DNA. Within a cell's DNA is instructions that tell a cell what to do. These mutations tell the cells to grow uncontrollably and to continue living after normal cells would usually die. These accumulating cells can then form a tumor. When this is left untreated, as pancreatic cancer does go untreated for a very long time, the pancreatic cancer cells can spread to further organs and blood vessels. In most pancreatic cancer cases, it begins in the cells that line the ducts of the pancreas. This is known as a specific form called pancreatic adenocarcinoma, or pancreatic exocrine cancer. Cancer can also form in the hormone-producing cells or the neuroendocrine cells of the pancreas. These types of cancers are called pancreatic neuroendocrine tumors, islet cell tumors, or pancreatic endocrine cancer. This takes us to slide 5, diagnosis. As we talked about before, the early signs of pancreatic cancer do not usually get detected as they are not very distinctive. The most common symptom is unintentional weight loss. Many individuals with the cancer will experience nausea and vomiting and feeling of fatigue, as well as jaundice. As notable as it is turning the skin and the whites of the eyes yellow, the individual will experience pain in their abdomen and or their back. This is often due to tumors in the body and the tail of the pancreas. Individuals in rare cancers will also have recently been diagnosed with type 2 diabetes, as well as experiencing unexplained blood vessel inflammation due to blood clots. Lastly, experiencing an attack of pancreatitis. With all these signs and symptoms, a doctor may be able to suspect pancreatic cancer and hopefully diagnose it. Jaundice and a swollen gallbladder can also raise suspicion. Aside from just a doctor's suspicion, medical imaging techniques such as a CT scan and an endoscopic ultrasound are used to confirm the diagnosis or help decide if the tumor can be surgically removed. An abdominal ultrasound can also be used, but is less sensitive and can miss smaller tumors, but can identify the cancer has spread to the liver. It's often used for a first examination or for a cheaper examination, as this can get very pricey. Liver function tests can show bile duct obstruction. Lastly, magnetic resonance imaging and positron emissions tomography can be used. This leads us to slide 6, management. One of the ideal ways of management is surgery, but is often rare to come by as this cancer is often caught too late and way too late to undergo surgery. Whether or not you undergo this surgery depends on how far the cancer has spread in your body. The exact area of the tumor is also a major factor. This is where a CT scan can come in and can help to determine if it can be surgically performed on. Sadly though, surgery with an intention of curing an individual from this cancer is only possible in 1/5 of cases. This is because it's hard to evaluate if the tumor can be fully removed, and this is often only noticed during surgery. as in often cases, it's not possible to remove the entire tumor without damaging vital tissues. Many factors go into determining if surgery can be an option. A specific surgical procedure is the Whipple procedure, and on this slide I have included pictures of the idea of the procedure. This is the most commonly attempted surgical treatment for pancreatic cancer, and it is a major operation. As you can see in the pictures, it's crazy. A second, more likely management treatment is chemotherapy. Chemotherapy is used to extend the individual's life or improve quality of life. This can reduce the cancer level to a level where surgery can be performed, but in many cases for pancreatic cancer, it is just to extend an individual's life period. In my personal experience, chemo made my father very ill. Constant nausea and vomiting. He hated it, and it definitely didn't improve his quality of life. Radiotherapy is another option. It is a treatment that attempts to shrink a tumor to a smaller state, but there are conflicting results from the trial of it. Bringing in my personal experience with my father again, also doing radiotherapy, it completely burned my father's skin, and he was in pain from this as well. In most cases, sadly, palliative care is recommended. This is a treatment that focuses on improving quality of life. This is often the only treatment offered, as pancreatic cancer is often discovered too late. It doesn't treat the cancer itself, but more of the symptoms, the pain, nausea, and making an individual more comfortable. Hospice care is also introduced, and that's what my father used. This also allows the individual to be given pain medications and really just helps to assist the family with taking care of the individual and making sure they're comfortable in their last months and that they're not in much pain. And that's it for my presentation. This is where I will pass it off to my partner Mariah, and she will continue on to slide 7, focusing on prognosis. Thank you.